Hi, my name is Gail Johnson. I'm a dental hygienist who has a passion for diabetes because my own son was diagnosed when he was 2 years old, and now he's almost 16, so over the years I've learned a lot about diabetes. I want to take a minute to explain in a very simplified way what an A1C is. Sometimes people call it HbA1c. Well, we all know that sugar sticks to things. It even actually sticks to things in the body, including proteins, which it really likes in particular. An A1C is measuring the amount of sugar or glucose that bonds to the red blood cells over about 2 to 3 months. It's a screening, and it monitors the blood glucose levels. It's not used to diagnose diabetes. When used for screening in the dental office, don't worry, you don't have to be a phlebotomist. It's only a finger stick, and the results are as quick as 5 minutes. One of the things that I've learned is there are a lot of people out there who are not sure of the implications that diabetes would have for their own mouth. So I feel as a hygienist, I have been able to connect with those people and talk to them a little bit about how diabetes not only affects their whole body, but especially the oral cavity. Long before I knew anything about diabetes, I learned the hard way when it comes to what diabetes can do to the tissues in your mouth. And that is because I had a patient, I'm going to call him Harold. It was maybe 1 year after I had graduated from dental hygiene school. I had completed 4 quadrants of root planing and scaling with anesthetic and was really kind of excited about it. He was a great patient. He understood why the procedure was needed. And when he came back for the 6-week perio reeval, I was really excited until I started measuring the numbers. All of a sudden, it's almost like I didn't know what to do with the numbers that I was getting. And back then, you don't have a Facebook group where you can share, hey, what is your experience with this? So I calmly took the numbers and looked at them because nothing had resolved. No numbers had shown a great resolution, and in fact, some were worse. So I thought, I don't know what to do with this. I don't have a space for this. I looked at his medical history again, and it was clean. So the next thing I did was I went to his medical history, and I looked on it, and it confirmed there was no yes boxes marked. He had a clean health history, no medicines, anything. So I began to talk with him and question, is there a possibility that you might have high blood pressure? His answer was no. Is there a possibility that you might have diabetes? Again, his answer was no. No new medications. I couldn't get anywhere as far as systemic issues. And I told him the reason I was asking was because the tissue resolution was not what I would have expected after 4 quadrants of root planing and increased home care for him. So we sat down and talked about it a little bit more, and I then asked him when the last time he went to his primary care physician, and he couldn't tell me that. So I asked him if he would do that because I felt pretty sure that the numbers that I was seeing was not due to my lack of skills or his lack of hygiene, but there was something else present. Now, I wasn't sure if Harold was going to follow through and see his physician. Honestly, I wasn't sure if he was going to do that because he said, you know what, let's check it again in 3 months. What could I do? I had made my recommendations. I had taken the notes. We had talked about it. I thought he understood. So I let it go, and I thought, all right, we will check on at the next 3 months. But then something very curious happened, and that is his daughter came in about 2 weeks later. I asked her how she was doing, how was her weekend, and then she gave me the answer that I was not surprised to hear, and that is that She and her mother had taken her father, Harold, to the emergency room over the weekend. And guess what? I guess his blood pressure was so sky high that they admitted him. And while he was in the hospital, they found out that he also had diabetes. So that was, even though I wasn't happy to hear that for Harold, my feelings about that there must be something systemic were confirmed. So then I saw Harold in about 3 months, and it was like a totally different person. He had lost weight, and more than that, his tissues were like a different mouth. So I learned a lot that day. And I say it over and over through 26 years of being a dental hygienist. I learned so much from my patients and from practicing, because dental hygiene is a practice that involves science and art. The numbers for diabetes are startling. There are 30 million people in the US living with diabetes. And more amazing than that, 8 million of them are undiagnosed. And if one of these 8 million undiagnosed people happens to be in your chair, there is going to be an unanswered question if tissue does not resolve. What is causing this? Why, after you doing your best and the patient doing their best, why has the tissue not healed? And that's why it was so important when the ADA gave us the ability to do a point of care testing for the A1C. What I feel I'm speaking about is connecting the dots. It's connection. And just like if you had a coloring book with the connect the dots drawn out for you, if there were certain numbers missing in that picture, you could not draw the picture because the dots are missing. And if we are missing things in the health history that are going to show up in the mouth, it is like trying to connect the dots without the adequate dots available. So to listen to your patients and to connect the symptoms that they're displaying with the health history and your treatment plan is of the utmost importance.